Okay. Hi, Mohammed. This is Dr. Hobson. We're here to just continue training the aides for RCFG. What we're going to do right now is I want you to, we're going to practice GOPex. Now, GOPex, we've done some counting. Now we're going to do some chewing and swallowing. What I want you to know is that the GOPex counting, you have to be sitting in a position where your feet are flat on the ground, your knees are bent at 90, your hips are bent at 90. So it's straight. You're going to stack your bones. Then either there's always crackers in the cart, or there'll be maybe carrots in the refrigerator, 5 carrots that I brought. I'm going to show you with my carrot. What I'm going to do is take a bite, keep my mouth closed, soft lips together, chewing, kind of chewing, not just on one side, kind of making sure that you're chewing on both sides. You want to gather it into a ball. And once the patient has it into a ball, I have them kind of show me the ball of food so that I know that it's not just all over the tongue. Okay. I want them to gather and use their tongue to gather it into a little ball. They call it the bolus. In speech pathology, it's a ball. Then after that, you place your tongue in the roof of your mouth. Mm-hmm. Your face, your body's straight, your tongue is up, the food is right in the middle. So your tongue's going to go here and the food is right in the middle. And I call it the invisible swallow. I tell patients, you get that position, your face is relaxed, put one finger up, 2 fingers up, and you point. And I have them point and watch my face not move, but my throat goes gunk. Okay. So it looks like this. Now I'm starting to gather it.
Okay.
You don't see it.
Yeah, I can see.
Now, what many of our patients do is this. That person with TMJ patients continuously, we swallow 1,500 to 2,000 times a day. It's a lot of compression here. So we're trying to relax their face. We're trying to reduce tension in their head and neck so they don't have so much facial pain. So swallowing is a very important part of our training. So what I want you to do is, what do you have to eat right now?
I have bread.
That's fine. So ideally, whoever's watching this video, I want you to get something to eat right now. Get a cracker, get your lunch, get something to eat so that you can practice this with me. Okay, so you're sitting up tall, you're chewing, and I tell people exactly what I'm telling you. Soft lips together. So your lips are together, but soft. You're going to use both sides of your mouth. You're going to chew, chew, chew. And then until the food is soupy, like it's got to be broken down and a little soupy, and gather it into a ball. Take your time. A lot of people don't chew enough. They eat things whole, and it's almost like dogs, like they just and then down. We need to use our mouth properly to have good oral hygiene and good head and neck function. Okay, so when you're ready, take your time.
It's quite big.
Yeah, so that's the thing. You don't want to take not such a big bite, right? It's okay, keep doing. But don't swallow yet, right? You're going to show me the ball. And just open and let me see what I can see. Yep. Okay. Now put it in the middle of your tongue, close your mouth, put one finger up, two fingers up. That's a pause of 2 seconds. And then you point to your throat and make sure this is invisible, that it doesn't move. You don't purse there. Go ahead and point when you're swallowing. So you see what you just did? First of all, I want you to kind of point. After you go 1, 2, pause, point. And that's when you swallow, because we want them to look and you want to look, and you just go 1, 2, and
Okay.
now gather a little spit. Pretend that you have food in your mouth.
I can do it again.
Okay. But littler.
A little higher.
So you're going to chew until it's nice and mushy, nice and soupy, that it's not whole. Yes. Okay, sit up tall, stack the bones. Then 1 finger up, 2 fingers up, point, and no movement of the neck, no movement of the face. Gagunk. Okay, not bad, not bad. So what you're looking for is that they compensate by that's not good. And like the mouth pursing and the neck craning. So they should stay perfectly still. And to do a proper swallow, they take their time to chew, gather a ball, 1, 2, point, and swallow. Okay. Let's practice an invisible swallow without food. So now gather a little spit. They're facing a mirror. They're stacked up. Their knees are in 90 degrees, everything. Now, 1 finger up. Watch me first. 2 fingers up. Watch me first. Okay. Did you see that? You want to see gunk. Now try it yourself. Gather some spit. Very good. Very good. So I want them to be able to do it with spit and with a cracker or carrot, or if they have food, they can use their own food. Okay. All right. So now let me just go back to GOPex. I'm going to go to GOPex. Let me pull up the reading exercise. And I'm going to share screen with you. Okay, so this is very important, believe it or not. People mouth breathe while they talk. So this is a way for us to train them. So this is GOPex reading exercise. So the point of this, they can be sitting or they can be standing. You'll see in RCFG, we have like a, we have a, you need to go?
Thanks. I'm going to eat.
Okay, so I'm going to record this. Okay, and then I'm going to ask you to call me right back. How much time do you need?
Just 10 minutes.
Okay. Okay, so I'm gonna keep going and then I'm gonna stop recording.
Okay.
And we'll practice it together, but I'm gonna record right now.
Okay, sure.
I'm right back. And maybe put me on mute for a moment.
For sure.
Okay. Okay, so reading out loud, what you want to do is either have them in sitting the same position as GOPex, counting or chewing and swallowing, or you'll notice in the RCFG rooms, there's a music stand. Put it high so that they can read looking straight at it. The whole point of this is to make sure that their mouth is closed at the periods and at the commas. Many people mouth breathe as they talk. They talk, and then they suck in. They talk, they suck in. They talk. So it's all mouth breathing the whole time. And notice I have to take a break and Inhale through my nose. This is a clinic that is basically meant to make sure that we're all nose breathing. Okay, so what you want to do is have them sit up tall or stand up tall with the music stand and have this piece of paper out. It should be on the music stand. I'm going to inhale, pause, and say, reading out loud is an excellent practical application of this process. At the period, I'm going to close my mouth with my tongue up, breathe gently. It only takes 5 to 20 minutes each day, mouth closed at the periods. Reading out loud and punctuating each sentence correctly. With each comma and full stop, mouth closed, remember to pause with your mouth fully closed in the click, click, close position and breathe in only through your nose. Make sure to sit and stand. So if you see me doing this, it's because I'm breathing. Just, you don't have, I do this for patients. You might want to try that, but you want them to see their face. You have to be in some kind of a shield so nobody is, that they're not out. You want to have them in a room that is either a closed room or a shield around them, like a little barrier, and they're in front of a mirror. So every period, your mouth is closed, your tongue up, and you gently breathe. At the commas, you split second, mouth closed. Okay, and if they need a breath, then you do it then. So if you see me doing this, it's because I'm breathing. Make sure to sit or stand with your back straight and your shoulders relaxed as we show in pages 7 and 10. Place the text you want to read on a music stand or a convenient place so you can keep the book at eye level. Imagine you're reading a paragraph in front of your school assembly. Speak slowly and clearly, pronouncing each word correctly. When you need to breathe, do so through your nose. So I want you to take a moment, pause the video, and do this exercise. It's one of those things that unless you do it, you do not get it. You have to understand what it feels like. Some people that mouth breathe are going to have a hard time holding their, not breathing before that. A lot of people kind of breathe between the sentence. You want to try to get them to only breathe at the periods, and if they need a breath in between, at the commas. So take a moment now and pause the video and practice it out loud. Okay, so now what I'd like you to know, I'm going to just practice one more time the counting exercise so you see it one more time. I'll do it to 20. You have to sit up straight. This is the full GOPex program is counting, reading, and swallowing. So what you want to do is you breathe in. You're going to count to 5 with closing your mouth in between each count. Relax face. I'm going to stop share. So you're going to breathe in, pause, say 1, mouth closed, tongue up, 2, mouth closed, tongue up, 3. And I will cue people by saying breathe in. And I'll say 1, close your mouth, tongue up. 2, keep your tongue up. 3, relax your face. 4, tongue up, relax your face. 5, now gently breathe in. Pause. 6, mouth closed, tongue up. So those are the cues you can say with patients. You can say, make sure you sit up straight, knees at 90, hips at 90, shoulders back. Gently breathe in, pause, say 1, mouth closed, tongue up. 2, mouth closed, tongue up. Look at your lips. Make sure you're not pursed. A lot of people say 3, 4, 5. You want tongue up. I call it like boring face. So you want to make sure that your face is completely relaxed. So I'm going to do to 20 so you can see it. And then I want you to pause and practice. Gently breathe in. One, 2, 3, 4, 5, 6, 7, 8, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. The whole point of it is to work on your posture and work on your oral posture, tongue up, mouth closed, relaxed face, but no tension in the face. And you also have to wait and only breathe at every 5. So that works on your breathing so that you're not breathing so fast. Okay, watch this, practice, and then you'll be able to work with the patients a little bit better.